Welcome everyone to this CCR training session. Again, the CCR stands for the Centre for Clinical and Care Research. So this sits within the Northern Care Alliance Research and Innovation team. I'll be presenting alongside Kate Grimshaw today. So Kate has a background as a dietitian and she's also a clinical research fellow in the CCR. My background is as a physiotherapist. I'm in the Berry Integrated Pain Service and I'm also a clinical research fellow within the CCR. This session should take about 30 minutes through the presentation and there'll be time for questions at the end. And hopefully by the end of this session, we will have answered our title question, which is my project research? So I'll hand over to Kate.
Thanks, Debbie. So Debbie's going to be moving the slides for me. So we did have a little practice, but as Debbie mentioned, we're both working in the Centre for the CCR, the Centre for Clinical and Care Research. And really, there's a team of 6 of us, and the remit is really to support people and to build capacity and capability in research amongst nurses, midwives, AHPs, health scientists, there's a little picture of those of us in the team, and you can see with the logo at the side that we've got 4 focuses really. There's talent spotting, helping people develop their research career pathways, mentorship and support of individuals wanting to engage and undertake clinical research, and then the research skills development. And obviously this presentation sits under the research skills development, and it will end up on the CCR area of the website, the NCA website, along with other presentations that we've already done and plan to do. And so why would we want to undertake clinical research? Well, clinical research is for everyone, it's everyone's future, and evidence shows that it definitely improves patient care because we're constantly looking and changing practices and learning from what's going on at the coalface, as it were. It makes sure that there is evidence-based practice so that we can actually look to see what is the best ways of treating and preventing disease and keeping healthy. It enables clinical practice to evolve, and it's really important also in the retention and recruitment of staff and quality staff, and those are really why it's important that we undertake clinical research. And then there's almost like that we're being encouraged ourselves. So doing clinical research was a priority in the NHS long-term plan, AHP strategy, the NCA R&I strategy. It's also now becoming part of job descriptions, and those of us who are on job plans, it should be in there. And it's one of the 4 pillars of advanced clinical practice. So there really is nationally, and the NCA is really going along with this, a push for us all to be thinking about research, listening to those questions that we might have when we're working. So what is research? So as a little bit of a background, there can be sometimes we're asked, is my project research? Well, if it's not research, what might it be? So this is a nice table that really summarises perhaps what the other alternatives would be. So starting on the right-hand side, we go and moving left. So we've got clinical audit, service evaluation, quality improvement and research. And the aim, if we have a look at these, so the aim of an audit is to produce information about the care that's being delivered, and it tends to be measured against an existing standard or a policy, something that we should be aiming to achieve. A service evaluation, it wants to again be looking at current care, and again, is it meeting a required standard? A quality improvement, again, it's looking at what care is being delivered, but looking, can we do this better? How might we be able to do this better? And research is obviously to gain new knowledge, but it's often to answer a specific question, and so you end up measuring specific take specific measurements that you decide beforehand to answer a question, whereas for some of the other measurements you're collecting data but you don't know what it's going to where it's going to take you almost. So there's different methods. So as we said, they all to do with data, but some for audit, you're measuring it against a standard. in service evaluation, again, it's just collecting some data. In QI, it's an iterative process, and by that it means that it's moving on. You look at what's going, you make some changes, and you see if that's helped or not. And then the methods, there's different type of research methods, quantitative or qualitative. Quantitative tends to be around numbers, and perhaps is what we may traditionally think of as research, thinking numbers, collect them, and then analysing them, finding out the average or the mean. And qualitative is asking about people's thoughts and perceptions. So I'm not going to go through the other lines in such detail. I've just talked a little bit about the data, and then at the bottom is basically do we need ethics? And I know Debbie's going to cover this a little bit later, but for audit, service evaluation and QI, there's no ethics, and some research doesn't need ethics and some does. So then, as well as having a table, it's all very good me putting it in a table. I thought actually having some examples of what research, QI, service evaluation and audit would look like would be helpful. So the first slide that I'm going to show you now is audit. Now, just to let you know, all of these examples are from the dietetic service, and that's just because basically I easily had that data to hand. So we carried out an audit in 2023 looking at nutrition screening, and the aim, you can see, and the objective was to actually monitor compliance against the Trust Nutrition Screening Policy, and that's what an audit does, collects data to compare it to an existing policy or an existing standard. And you can see that what then happened was, we've got, next slide please Debbie. So the methods looked against 3 standards. So one, standard A was that patients were screened, standard B was another, that they had a care plan, and standard 3 that they had documented EPR. And the next slide show us actually, so this is what it looks like. We were looking as to the standard of having a screening within 12 hours, and you can see what the compliance was. We've got the standard B, which is looking at the compliance, and again, it's just, we're not going into the detail of what it's telling us, but this is showing what the compliance is against the policy. And then standard C is similar, again, just the accuracy and how we're meeting against the standards. And so obviously you can see there was a range. So that's audit, collecting data and comparing it to a standard. Then we have service evaluation, and this again is something that happened in the dietetic team and within stroke. And when we look at the next slides, we'll see that the aim was actually to look to see what was the care being delivered at that time. So measuring and it's like it says on the tin, the service evaluation, looking to see what we were doing. So then looking forward, what we did is we looked at the data that was collected as baseline, and then we actually put in some more dietetic care to see if it made a change. And if we have the next slide, we can see then that actually the blue and the red bars, the blue bars is the service delivery at baseline, and the red lines was the service delivery after changing some of the different things. So that's looking at service evaluation. The next one is a QI project that within the NCA, we're really QI focused. I think we're all very happy talking about QI. And this is a project that you may have heard about that's talking about but first to drink. And if we look at the next slide, it's basically saying that this project, this QI project, had 3 PDSA cycles, which is a methodology that you use in QI, that's plan, do, study, act. And so for the first PDSA cycle, they were planning and collecting information, working on the team, looking to see what the data was, collecting baseline data and asking the staff and acting. And then you moved on that and you had another PDSA cycle and then another one. And that's quality improvement. We don't know where the results take us, and we almost go on a journey not knowing where we're going to end up, but we look at the steps en route. And then finally, there's the research, and this is just a copy of a poster of some research that was supported by the Committee of Allied Health Professionals Research. And you can see at the top, it says the aim was to explore the use of nutritional outcomes. And if we look at, if you looked in more detail, basically what the aim of the study was to find out, are outcomes used and how are they used, what is being used, and are they effective? So you can imagine, you can see that there was a research question that we wanted an answer to, and that's what made it research. So bringing us back to the table again, I'm now going to hand over. We're going to focus in on what is research, giving you a little bit of background of what those other things that take into account and that you're collecting data that we need to think about. But why is this research? And I'm going to hand over to Debbie now. Thank you.
Thank you, Kate. And I'm sharing here a really helpful resource. It's from the NHS Health Education England. It's a framework for advanced clinical practice. And even though it's talking about advanced clinical practice, I would say this is relevant for everyone at all stages of their clinical and clinical academic careers, because what it does is give a section on how you can demonstrate that you're being research active. So Kate previously explained those differences between research, service evaluation, audit and quality improvements. But actually, if you're active in many of those different things, you can show that you are being active in research and demonstrate that activity. So as examples, these are the things contained within this framework as evidence of research activity. So we've got things like, as soon as you're adhering to evidence-based practice or guidance, you're demonstrating research activity. So this might be that you're reading the newly published NICE guidelines. I know we've recently had the NICE OA updated guidelines, and we're reading it through, and within, say, my physio department, we're thinking, right, which parts of this do we need to implement? Are there any changes in our service that we need to do in order to be adhering to these guidelines? You can undertake a service evaluation, audit or QI project, but most importantly, act on those findings. So if it is that you've undertaken one of those practices and you found there is something lacking in the department or something that's not quite working, what changes can you make to act on it? You can demonstrate being research active when you critically appraise relevant research. And again, this could be from a single journal article that you had an interest in, that you've been signposted to from your clinical profession, or as a group within your department, you want to start looking at articles. It might be, like we said before, NICE guidelines. They do all of that lovely summarising for us. They gather the best, most appropriate research, make guidelines, but they'll signpost towards where that research evidence came from, and also other unanswered research questions. And again, as clinical practitioners, we want to be implementing the most up-to-date practice. So this keeps us safe and up-to-date if we're using that evidence. You can also think about, are there any gaps in your current practice? So is there something that actually you've tried to find a literature review on and you can't find, or there doesn't seem to be a clear guide on it, and you think, well, why are we still treating this condition in this way? Is there a gap in what's known in the evidence? Could that be a research project or a project for audit or service evaluation as a starting point? Is there something around safety though? Is there something that you're doing that you think actually there's probably a better, more safer way of doing it? And it might be that actually as a department you think about priority setting activities, so it's almost questioning what you're doing, whether you're implementing the right thing or there's difference of opinions. And actually using that as a priority setting activity within the department to think, what's our most important thing, the most important question that we want to answer? You can also demonstrate research activity by identifying research topics through leading your own project or supporting others. And again, this depends on your confidence in leading those projects and perhaps stage of research or audit and evaluation experience, but actually supporting other people to do their research project. If you're the person who's distributing questionnaires or asking patients to take home a participant information sheet, again, you're contributing to research. Is there anything around your governance or documentation systems, thinking about the quality of the data you're collecting and how accessible it is? Again, much of the data we want to explore and look for patterns we're already collecting within our systems, but often it's what are we doing with that? What are we using those findings for? You can disseminate your research, service evaluation, audit and QI projects, and this might be through bulletins, but it might be opportunities to present posters within the Northern Care Alliance. So maybe there's an AHP event or a nursing event, or at your professional conference. So opportunities to present either via a poster or an oral presentation is a really great way of finding what you're showing. There's also opportunities to collaborate with researchers. Within the Northern Care Alliance, we've got a real range of research active clinicians and links with our local universities, including MMU, Salford and Manchester, but also wider than that as well. For example, I'm currently linking with Keele and Leeds universities. So perhaps just to summarise some of those points from the Health Education England framework, in answering the question of how can I actually be research active in my clinical practice. So we mentioned things about critical appraisal of a research paper. It might be a single paper, but it might become more than that. There might be a journal club that you can start up, and every now and then you want to go through an article and really question what research has been undertaken. Have they answered a hypothesis? What methods do they implement? Again, if you want help or assistance with this, either ask us or also the librarians. And that brings us on to the next point, undertaking a literature review. Again, this can be quite a big undertaking, or it could be a small one. You can do a quick search on PubMed and come up with loads of really interesting papers. Or you might want to do that more formally using the librarians for help as well. Again, disseminate what you're finding. If you undertake a service evaluation or audit, tell people what you've found. Make a difference using it. Present at conferences and trust events. Be sure to implement and review guidelines. So each time NICE produce their guidelines or updated guidelines, what implications does that have for your clinical practice so that you're up to date with evidence-based practice? Keep attending research training, such as today's events. There's a lot of training that's delivered by the Northern Care Alliance, by the CCR. We aim to host training sessions every couple of months. But also, if you're new to research or you'd like to get that background knowledge, the NIHR, that's the National Institute for Health and Care Research, their good clinical practice training is really good at giving that overview of the steps involved in undertaking research. You can be involved in collecting and analysing data, you can be supporting other people to collect data, or you can develop yourself as a principal investigator. And the NIHR holds schemes for that purpose. They're called the Research Scholars Programme, and that's all about developing you as an individual so that you could be the person in charge of running a research study on a day-to-day process or progress as a principal investigator. You might want to apply for a research internship to gain a wider knowledge of research and some experience. And the CCR are offering opportunities for research internships. There's also other opportunities for internships from the NIHR, from ARC, and other bodies. And again, it might be related to your clinical professional group. You might want to start developing a protocol for either a research study or an audit or service evaluation, and you might want to then start leading your own project. If you're thinking about leading a research project, these are some steps that you might want to consider. It always starts with that initial idea. So what is it that you're curious about? The question that you wonder, why do we always do this way? Is there research evidence for it? Is there a better way? Or comparing two different approaches. But you can rarely do research on your own. Develop your team of experts. They're the people who can keep reading your work and say, I think you might reach a problem if you do it this way. Have you thought about this way? Is there a better way of doing it? Is there someone who has already done something similar who can share their expertise with you? Definitely consult patient and public. So PPI's patient and public involvement. What's really important for them when they attend our services? What is it that they hope to see or they want to be answered? And actually, each time I consult PPI, they always inform me of things that I've written that probably on reflection don't make sense. It doesn't have as much relevance as I thought it did. So it really gets you to make sure your research can be implemented in future. You might need funding to do research, or you might not need any. That always depends on whether you need protected time to do it, any equipment, or you want to reimburse anyone who's involved. You might also need to apply for ethical approval. And again, as Kate mentioned, research often does need ethical approval, but not all research. If, for example, you wanted to run a systematic review, all of the data is already there for you. You don't need to go back to those initial participants who are involved in each individual study to ask permission. So you wouldn't need ethical approval for something like that. And do you think about completing good clinical practice training? If you're wondering about applying for funding, definitely ask for help. There's so many different avenues. It can become exciting but overwhelming thinking about where to apply for funding. So please do reach out to us in the CCR and we can help have those discussions with you. The research design services, Northwest, are also really informative and really helpful. They can also help to design your study. So once you've written a template, they can review that and then help and add comments for you. Think about your university collaborators. They might have sources of funding. They might be able to fund your project or again, guide towards applying for funding. And think about different sources of funding. So this could be charities, it might be the NIHR. I put on there an example, the Chartered Society of Physio. I know I've had previous funding from them, but also opportunities within the Northern Care Alliance. Do join mailing lists. So join the CCR mailing list, the NIHR mailing list, and hear about the latest funding. We mentioned then almost that question about when do I need ethics? So I think my project is a research project. Do I need ethical approval? And there's actually a really great decision-making tool to help you determine firstly if your project's research and then if you might need ethics. So if we firstly ask that question, is my project research? We do advise that you speak to us or go to this decision-making tool, and it's really easy. There's 3 questions as soon as you access this. It's like a flow chart. The first question it will ask is, are you randomizing patients to any different treatments? So is it that a certain group of patients are going to get treatment A and a certain group of patients are going to get treatment B? If you are, that's going to sound like research. The second question is, are you changing treatments? So as soon as you're testing out a new intervention, a new drug, you're looking at effectiveness, again, that sounded like research. And again, thinking back to that table that Kate spoke through about if you were looking at service evaluation or audits, you're really wanting to see whether an existing service is doing what we think it's doing rather than testing this new intervention. And then the third question on is my project research is really thinking, will my findings be widely generalizable? Are they transferable? Ultimately, research is looking for trends. It collects a lot of data from a large sample to say we can infer from these findings that we think this is going to happen on a bigger picture. If you compare that with your service evaluation, you're probably thinking, well, we've made this change within the service. Is it more cost effective? Is it lowering our waiting list? Those kind of things. So it's a more local finding. So if you answer yes to any of those questions, the likelihood is it's going to turn out that your project is research. The next question is, well, do I need ethical approval? And then you can move on to this other decision tool. So again, this is from the HRA, that's the Health Research Authority. And again, it's going to ask you first, is your study research, and then it will move you through a sequence of questions to think, is what you're doing needing ethical approval? And I'll hand over to Kate at that point. And I'm so sorry, Kate, you're still on mute.
Thank you. So many of us, when we're thinking about undertaking research, that there are things that can make it a little bit more detailed, and those are the barriers that we're thinking about. So first and foremost, the often thing we hear is protected time. It's very difficult. We have busy clinical jobs, and trying to eke out some time to do some research activity can sometimes seem impossible. Then there's funding that Debbie's talked about, so I won't go into that, but funding is important. Not only perhaps for finding backfill so that you can do some research and the work that you're currently doing is being done, or also actually funding the actual research. And then you need to have some team leader or some your team leader, your manager, the team lead needs to be supportive of that, and perhaps needs to understand the benefits of you undertaking the research. Without their support, things can be difficult to get started. Finding a research team, finding some help and support of what to do can sometimes be a barrier because people just don't know where to start or how to even get going. And then sometimes you want to do research but you can't think of a project. So if we just go back to each of these, and I'll talk about each one in time. So for protected time, research activities are basically now in people's jobs plans. So use this. The NCA is very keen that everybody thinks about research as being their job, something that they can get involved in. So research activities are in the job plan. So use this to demonstrate that that research should be being considered and we should be making time for that. Funding, there's lots of different options. We've heard from Debbie, and then there'll be some information on the next slide, and there'll be some information on the next slide about maybe support from the team leads and supporting from the research team, which you can get from the CCR. The thinking of a project, I'll say to you to listen to the voices in your head, and I'm not saying that people in research have all got little voices talking to us all the time, but what it does mean is when you're seeing a patient and you're there going, is this the best? Why do we do it this way? Well, how about if we did it like that? Listen to those thoughts, listen to those ideas, because that's the way that it gets us to the research that will really make a difference to patient care. So skipping along to the next slide. So these are lots of the different helps of resources. So obviously the CCR team, Debbie and I are part of that, and then there's another 4 people that can help with that. We can help you chat to your team lead if they can't see the importance of somebody undertaking research. We can help direct you to funding. We can help to get you started. We can marry you up. Some people want an idea but they need some help, and you want to help do some research but you don't have an idea. We can be a little research dating service and put people together. And then there's the Research and Innovation Office that can help registering your projects and directing you to different links. And then there's some other websites there that can help as detailed. And then moving on to the next slide, there's more help. So the Council for Allied Health Professionals Research, that poster that I showed that was for research was undertaken using money from that organisation. You can get help and support from your own professional bodies like the Royal College of Nursing, the Chartered Society of Physiotherapy, British Dietetic Association. There's lots of courses, there's things like this or other things that are done that are freely available and by the NIHR or other organisations that you can get. We can link you in with research mentors or even be your research mentor from the CCR, and so we can help with that. And also, as Debbie mentioned, there's internships that we can direct you to and point you to that can give you a little taster of research. And the library services, they're great at helping you do literature searches and actually answer some of those initial questions that you need to have before you maybe start doing your research. And then obviously there's lots of interest groups on social media, so those are quite useful for you to do that, particularly if you're active on that. So the next steps really. So we have the CCR does a thinking hub every other month. So the next one is on the 2nd of August, and basically it's an opportunity to just come and have a chat to the team. If you meet up some other people who are interested, if you've got any research questions, and actually sometimes it's really difficult to put something down in an email, so you don't want to necessarily email us. You'd like to chat to somebody, this is the perfect opportunity. You can email us, there's the CCR email address. If you want to have the mailing list of the internship and funding opportunities and other things, email Claire Mooney. And what we would also like from you is any suggestions for further training that you would like that we could put on, and then they go on the CCR website and they're available for people to listen to as and when they need to. So that's the end of the presentation. So what we want to say is good luck with starting off on any of your research endeavours, but are there any questions at all specifically that you may want to ask us? So thank you very much for your attention, and any questions, just let us know or put something in the chat. Thanks.
So we have to be quiet.
Hi, can you hear me?
We can, yes. Lovely.
My microphone wasn't working before. From a future training point of view, I'd be really interested in anything to do with sort of data collection, really. I feel it's a real weakness of mine, it sort of puts me off really going further forward with research. I think that sort of links in with sort of IT skills and things, which I'm trying to, there's lots of other opportunities, you know, like online courses that the NCA are doing. But I think for me, that's one of the biggest hurdles that I'm facing at the moment is about data. And it sort of puts me off slightly, really. I'm doing the Associate Principal Investigator scheme at the moment, and that's been really good. And there's been lots of learning lectures with that as well, which I've really enjoyed. I think that's been a really good way of finding out more about research in general.
So who are you doing that with?
So it's Dan Horner. So it's emergency and trauma. So we're starting off a study called ACIT, which it's taken a very long time to start up. That's the only thing with the associate scheme. You've got a 6-month window of opportunity, and it's not even started yet. So I've had to ask for extra time, which they've given me. You know, that's been fine. I think that's something which I hadn't quite understood. If sometimes it takes a long time for the studies to actually start.
Yes, that's useful to know. We've got somebody who is running a study at the moment, and we're going to have an associate PI, but we haven't got them yet because we want them to start once we've got studies recruited, you know, participants. And just to answer your question about data, I've got a meeting in with the statisticians who are in the research and design service to actually have a chat as to maybe what training is required by people. So if you watch this space, we'll definitely be having something. But if you email the CCR and just mention, you know, if you want to have a one-to-one chat with somebody before then we'd be able to help with that.
Okay, thank you. That's great.
And Claire, I was going to ask, thank you so much. It's such a great suggestion of training, and as Kate said, I think we're statistics was kind of on our radar. But I'm wondering, because you mentioned data collection, can I ask, is that kind of not feeling so confident, is it collecting questionnaire data or kind of observable data from patients, or is it qualitative? Is it interviewing? Or actually, would that be the training of what are the different types? How could I collect it?
So I think this the study is being run at the moment on 2 different sites. One's London and one's Oxford, and we've had some meetings with them, and they were saying, you know, it's going to need a completely new database because of the amount of information that needs to be collected. So this is about blood result type information, really. Like they were saying that on an Excel spreadsheet, which I'm not very good with Excel even, it goes on for, you know, pages and pages long, the amount of information there is. And for me, I just find that slightly overwhelming of what can I contribute to that, which obviously I want to, but when you're talking about so much data, I think I feel like I'd need to start off on the very basics, and I have said this to my mentor, to then build up to something, the amount of information that they're looking at.
Yeah. And I think
that's really useful, and like I say, if you want anything like more individual and specific, we can have a chat with you about that. I mean, I was on a meeting this morning, and the Power BI guy I was talking to was happy to do some basic Excel stuff. So I think there's things like that around, but I think if you email us, we could maybe look, but we might need to have almost, you know, a couple of sort of data type stats training type things, but that's really useful to give us a pointer. So that's great.
You.
And actually, Claire, I don't know if you've been given any guides to starting off with Excel. Only because I had a similar conversation with someone, and I said I didn't realise how much Excel can actually do. And then they shared some training slides with me. I wondered if you had access to that, and if not, perhaps if I can ask permission, I could send it over.
Yeah, no, that'd be great. I've not seen that. I know that the NCA are looking at sort of for clinical staff for the IT development that they need. There does seem to, I was booked on one last week, but then it got cancelled at the last minute, unfortunately. So I think they are trying to, just generally, never mind to do with research, but to try and make us more IT savvy.
Yeah, I know, absolutely. No, well, I think I would champion that. I think that would be brilliant training. Thank you. That's such a great suggestion, and it's great to hear that actually you've been awarded one of the PI programs as well, and definitely we can empathise with that difficulty of timing, isn't it? You want to have this brilliant experience, but sometimes the study isn't up and running at that time. So I'm so pleased they've been able to delay it slightly so you can still get some research experience. So yeah, great. Do you know what you'll do next?
I'm an advanced practitioner, so there's some study days that they're running in the NCA for some research specific days for advanced practice.
We're running that's being run by the CCR. So
I think there was some this year, but I wasn't able to go to all the dates, so they're putting some more on for the beginning of next year. So they're the ones that I'm going to do.
Oh, that's brilliant.
Super, lovely. Oh, well, we'll meet you in person there.
Yes,
that's great.
Yeah, thank you.
Okay.
Oh no, thanks so much for coming today.
Thanks.